Good morning. I am Glenn Robitaille, and I'm the director for both the Ethics and Spiritual Care portfolio and the Ontario Structured Psychotherapy program for North Simcoe Muskoka. And I'm here to talk with you today about the subject of faith-based healthcare and how that is different. Now, meeting virtually, of course, is not ideal as we cannot have the kinds of conversations that may be helpful to you. But we're going to do it this way, and I will say that up on the screen now uh, is my address. And you can either email me or you can telephone me if you have any questions whatsoever. So first, I think the first question we need to ask is whether there really is a difference in faith-based healthcare. Certainly, all healthcare providers, secular, whether they're in a faith-based system, a Catholic system, a Jewish system, or just a public hospital of another kind, people who generally want to provide good care are attracted to these helping professions. I think the main difference that we should recognize is that faith-based healthcare, particularly Catholic healthcare, was born out of a need to reach the vulnerable and those that would not otherwise receive care. And during times of epidemic, such as the typhus and the typhoid epidemics that occurred, Catholic orders, nuns mostly, went to these remote areas and brought health services to people who otherwise would not get them. And the spirit of that remains. And so when we look at that, what was it that caused them to do that? In spite of the fact they probably weren't getting paid much more than their living, their living expenses. And I would reduce that down to this idea of calling. So lots of professions use the idea of calling. It's certainly not unique to people who come from a religious order of some kind. Medical staff often would use that. Teachers, and I think what separates those vocations that would use the idea of calling to underscore the reasons why they're doing the work they do from those that maybe would not is this idea of there being a higher motivation than simply a paycheck. Certain professions require you to bring something of yourself beyond what would normally be expected. The work itself can take something from you. And so people have to have a certain passion to do those roles because it requires an extra level of commitment in order to do that. And certainly when you think about mental health care, this is one area where a sense of calling is really important among those, particularly who are working in direct care with our patients, because mental health care is the only area of health care that serves a largely reluctant population, which means most of the patients that we're serving really don't want to be here. Now, occasionally we do get we get patients who recognize that they're having a serious issue and they really want that help. But the longer you're in the system, the more often it becomes a case where they really don't want to be here. And then our ability to therapeutically engage them becomes even more important because of that. So let me start with that. But then let me ask, what should you expect then if you're working in a faith-based hospital? Well, let me say up front that you have the right to believe what you believe without coercion. Whatever you believe now and you bring to the workplace is your perspective and you're free to have it. You don't have to suddenly adopt Catholic thinking or Catholic theology in order to work in a Catholic hospital. However, we do ask you as an employee of Waypoint to respect the beliefs and the values that undergird Catholic healthcare. So while you have your private beliefs, when we perform our roles at Waypoint, we understand and we know the beliefs and values that undergird the way that we do our work as a faith-based hospital. And so where do we get those ideas? Well, mostly there are a lot of different places, but the one that's easily accessible and I think informs a lot of the way that we do our work is what's called the Catholic Health Ethics Guide. And so this is the tool that provides guidance to us in light of new advances in sciences and in medicine. But it does have a direct connection to the moral teachings of Jesus, not the religious teachings, but the moral teachings that address things such as social conscience. And so that's what I want to talk a little bit about here. We do have an informing story. Jesus liked to use those. And this particular one called the Parable of the Good Samaritan kind of captures everything that we want to say about what makes us different in the way that we perform our care. So let me tell you a bit of this story. Think of it as I'm sharing it as a moral lesson about healthcare and not necessarily a religious story. So in this story, there's a man who's traveling up from Jerusalem to Jericho. And to do that, he had to pass through the land of Samaria. And so this road, which still exists today, by the way, it's a much better road than it was back then, uh, was frequently traveled, but you did not travel it alone because there was a high risk that you were going to be beaten and robbed if you did so. So generally people went in caravan, excuse me, caravans. But for whatever reason on this day, the person in question did travel alone, was beaten and robbed and left for dead. And two officials from um, his own nation saw him lying there and passed by on the other side of the road and continued on with whatever business they had to do and did not help him. But coming the other way was a man of Samaria who saw him. And the story says he had compassion on him, bound up his wounds, poured oil on them, and then took him to an inn, which would have been the closest thing at that time to going to a hospital. It would have been like a hostel, because there he could receive care. And the man said, if he has any other needs, take care of them, and I'll catch up with you and pay for those on my way back. So that's the story of the Good Samaritan. The tension between the Samaritans and the people of Jerusalem or of Judea at that time was very similar to that of the Palestinians and the Israelis today. They had a common connection by heritage, but they had differences of opinion on political things. And let's just say that there was a lot of conflict between the two nations. So the fact that this Samaritan was the one who performed these acts is significant to the story. So the question I would ask, from a purely human perspective, what do you think this is trying to teach us about healthcare? And I'm sure you have ideas, and if we were together, I'd be checking what those are. But let me share a few that have been broadly mentioned in the past and that I see coming out of this story. First, the idea that when you work in healthcare, you don't walk by a person in need. There's an obligation that comes to you as a healthcare provider to make sure that if someone needs our help, that we provide that help. When we do deliver our care, we set our personal biases aside. Everybody has them. We all come from a certain social context. We have had our own enculturation. We have our own biases that are given to us by our upbringing. Biases are a fact of life. But whatever your personal biases are about any individual, when you're delivering healthcare, you set those aside and you deliver it each human being as a dignified individual. When we do our care, we don't just do the bare minimum, we go the extra mile. Now, this is something very important to Catholic healthcare. We're not just putting on band-aids, we're trying to go for the whole solution. And so when we're delivering our care, we're doing that to the best of our ability to provide the care that would be meaningful to the person and necessary. If we do make a commitment, we follow through on it. We don't make commitments simply to get the tension out of the moment. If we make a commitment, we follow through on it. So I'm assuming that in the story, the Samaritan gentleman did come back to the inn afterwards to check in on the guy and make sure that he settled with the innkeeper for any extra expenses. And then finally, and probably most importantly, we provide compassionate care, which means we just don't use our hands. We bring something of our humanity to that as well. We bring the heart. So there were two individuals who passed by. What do they talk to us about? What do they teach us about healthcare? And well, first of all, they may have had a really good reason for passing by. I'm not going to judge that. We don't always know what's going on in another person's life. But if we look at the sweep of history in times like this, we find that people are often afraid of what it's going to do to them health wise. We saw this when SARS happened back in the early 2000s. There were people who stepped up, and there were others that, for their own reasons, backed off and left their jobs or refused work. And again, lots of reasons why people might do that that are legitimate. I'm just observing it as a possibility. Saw the same thing with AIDS. And now with COVID happening, people are feeling this tension again. So that's one reason. Here in mental health care, it's often talked about the idea that when a person is appearing to need help, maybe that they really don't need help. They're playing possum. They're trying to draw you near because they've got some axe to grind or whatever. That may stop us from doing what we need to do. Uh, it might cost us something. It costs the person in the story time and perhaps some money to care for this gentleman. So a fear that it will cost us something if we stop is often one reason. In addictions, in particular, we see this idea that this person really isn't worthy of our time and energy because they brought this upon themselves. People don't always understand that uh, the uh, the blossom on addiction is not the root of the addiction, and that the root of addiction is actually something that could be entirely out of the control of the person, a predisposition towards addiction. And so that's why it's referred to as a disease, because the person doesn't choose the vulnerability, but people often judge the person as just being weak and if they just had more willpower. So there's a lot of stigma around that, but it's not the only area where people believe that a person has mental issues or addiction because of something that they chose and something that they did. And that may stop us from giving them the care they need. You want to be very careful about that if you're working on the forensic side of our hospital. uh, Many of the gentlemen that we're working with there have committed crimes. Some of them are pretty horrendous. But again, if they're with us, there's a mental health disorder that is a part of that that deserves our compassion. Often individuals who have committed crimes when they were not completely in their right state of mind become very regretful, some even suicidal after they realize the harm that they've done. When they have been given the proper medication, they are restored to some of their previous baseline. And then finally, it could just be as simple as this isn't my problem. I mean, we all see problems every day and we don't step up to the plate for every one of them. We try to be selective, and often people think this just isn't my problem. When we're working in a mental health facility, there will be times when it is our problem. So what I'm appealing to is, now that we've talked a bit about that, everyone has their own reasons for being compassionate. It may not be connected to the Catholic values at all, but the appeal is to identify the source of our compassion, however we got that, whatever it is that drew us into this field, and hang the principles that I just talked about, these principles right here, on those existing hooks. So what are those existing hooks? Excuse me. Well, it could be a social conscience. That's the reason a lot of people get into mental health care. They see the imbalances, they want to do something about it, and they want to help out. They're drawn for whatever reasons to that. I would say my early connection to mental health care came from that. Just made a visit to this facility in 1972, met a gentleman who had absolutely no one supporting him in the world. He asked for me to come in. That set me on a lifelong journey that has led to me being full time and doing this work. But it began with a recognition of the deficits that occur for people with mental health issues in our society. Maybe it's another spiritual framework that motivates you, not just Catholic healthcare. There are good uh, faith based networks all around the world. Mount Sinai Hospital is a Jewish healthcare facility in Toronto. Uh, Muslims were the first to create hospitals in the whole world. So often faith-based healthcare has been at the forefront of developing this kind of work. Maybe you just have a desire to help people. That's a common reason why people get into healthcare. It could be that you've had your own struggles with mental health. Um, a lot of employees would report that what drew them into mental health care work is the fact they've had to work through their own stuff and they want to help others. Or maybe you've had a family member, someone that you love who has struggled with a mental health issue, and that uh, has drawn you in. There are lots of different hooks. You may know better what would work for you to motivate you to bring your heart along with your hands to the work that we do. So from the Health Ethics Guide, some of the principles of ethics that we're going to describe are, first of all, the call to respect dignity, then foster trust and care, how we promote justice, and then the call to compassion and ethical reflection. I'm going to go through those briefly. First of all, with the call to respect dignity, we recognize as a faith-based hospital that dignity is important. We have the privilege of supporting people who have mental health needs. And so respect for them as persons is a hallmark of all faith-based healthcare, but particularly the way that we see things in Catholic healthcare. When we talk about dignity, we're recognizing that all persons have it. It's not something that they have to earn. We believe people have it by virtue of being human. Of course, those who are part of a Judeo-Christian tradition would say that that's true because of this notion of being created in the image of God. But whether we believe that or not, we can all recognize that human beings are the only species that are capable of impacting the entire planet, as we've seen with global warming and some of the changes to topography. Human beings have a tremendous power. So with that comes responsibility. And so that elevated status as those who can change the world gives everyone a certain amount of dignity as a human being. An emphasis on dignity recognizes that we're all in this together. We're interconnected. And there's evidence that would say that healing occurs faster and better when people feel that they're being treated with compassionate care, when there is that human connection. We also recognize that when people have a faith perspective, it's often their go-to coping strategy when they're unwell. So we do have a distinct emphasis on nurturing people according to their own beliefs and their own religious traditions, and on the idea we're treating the whole human being. And at Waypoint, because we have both a provincial program, which serves the whole province, that would be our atrium side, and a regional program that serves basically the area between just south of Perry Sound down to Orangeville, that we're going to see the entire world here over time. So we give respect to every cultural, religious, or linguistic community that comes to us, because any demographic that exists in the province of Ontario, we're capable of seeing here at Waypoint. So when we see individuals, regardless of their background, the care we deliver is devoid of any prejudice. Even if you have your own ideas, we don't bring them into the workplace. We respect all the different cultures and traditions of those who not only are our patients, but those who work within our organization. And this last bullet is really important, that this is one of those benefits of Catholic healthcare that may not be present in other forms of healthcare. And that's the idea that your conscience is really important. The last thing that we want is people going home at night feeling bad because they were required to do something that offended their moral conscience and created moral distress, which could lead to moral injury over time. So if you're being asked to do something that is not values based, or something that you believe is causing you personal injury, you have the obligation to talk with your manager about that, uh, to declare what your conflict is. And if it's one that can be met, our position as a hospital is we don't want people going home feeling bad at the end of the night. We're going to do what we need to do to make it so that that isn't the case for you. But again, the obligation is on the worker to let us know if a situation like that is existing. We always are trying to improve our cultural competence at Waypoint. That's something that we continue to do all the time with educational opportunities, both general and specific for individuals. That there are courses that can be registered for if we need to increase our competence for a certain demographic. I remember, we have brought an Inuit elder in as an example to train one of our whole programs who treat several individuals who come to us from Nunavut. And that's something that we're going to do. We also have a spiritual and cultural intake process that is done by the spiritual care team. We're one of the few hospitals that would do this. We take it very seriously. And when a person has had an admission of longer than 72 hours, they find out all the specific information that they need to know. And then they are able to transfer that information to the team so that everyone knows the specific things that are brought to us by this patient that they're telling us are important to supporting them as an individual within our organization. Secondly, we recognize that trust is really critical in healthcare, and nowhere is it more important than in mental health care. Because until you have gained the trust of the individual that you're working with, you may have a role. You can be assigned as a nurse, or you can be assigned as a doc, an OT, social worker. You can be assigned to work in housekeeping. You can have any role assigned to you, but until you have developed trust with the person, you do not have therapeutic engagement. So we recognize that people are going to be helped more efficiently and more effectively when we are able to establish a level of trust. And we do that by giving care to the and giving attention to the good of the person in the care that we're providing. And in a faith-based hospital, as well as in recovery, which is an approach to mental health care that we are trying to utilize here. Recovery and faith-based healthcare recognize that it is the individual who tells us what they see as being good for them. And we try to work with them according to those preferences. And if a person is incapable of making a decision around certain things, then we work with their substitute decision maker. But that's what the first level of trust involves, is making sure that we're focused on the person and gaining that from them. When we provide our care, we're not doing it solo. We recognize that we're just bringing one aspect. And so the importance of a team structure where all of the disciplines that are providing care are respected is very important. And that only happens when teams talk together, they develop care plans together, they respect the individual contributions of the other. And then those of us who are in leadership also have to respect that we need to take that information that's being given to us from those who are working in direct care and make sure that we're including that in the work that the way that we're organizing the strategic level of our work. So because of that, we have a commitment to sharing power, which means we're trying to get rich information from the grassroots, rich information from direct care, from those who are actually doing the work, in order to form our policies and the way that we make our decisions. Then there's the idea of justice. And justice in healthcare is all about promoting and restoring wholeness of life, but also about treating the causes of suffering and injustice. So when we talk about stigma, stigma is a concept that you'll hear a lot about in mental health care, because along with mental illness comes fear. And so people often who don't understand an illness can marginalize and stigmatize individuals who have them because they don't understand. So it's our obligation as those who work in mental health care to help be a part of the solution in reducing that. So no one can make stigma go away, but we can all increase awareness. And it is my belief, I don't care whether you're working on the grounds, in dietary, in housekeeping, if you have an administrative role, or whether you're working in a clinical role at Waypoint, every one of us who works at Waypoint gets a paycheck for one reason and one reason only. And that's because we are serving people with mental health problems and mental health disorders. So when we hear things that are stigmatizing of our patients, it's our responsibility to gently inform people of what they need to know. And one way that I like to do that is, if someone makes a stigmatizing comment, I'm not going to put them on the spot and try to embarrass them in front of a lot of people, but I will take them aside and I'll say, 1 out of 3 people are going to experience a mental health problem in their lifetimes. And 1 out of 5 are likely going to experience one this year. So if it's not you, it's going to be someone that you love. And when that happens, how would you like them to be regarded when they're going through that struggle? And how would you like others to speak about them? So we try to make it personal that way. That's something any of us can do. And I believe it's an obligation that comes to us to increase awareness, which over time can help to reduce stigma. We recognize in faith-based healthcare, and this is probably one of the highest principles that we respect in Catholic healthcare, is that we're serving a vulnerable population. And so when we talk about delivering care, we're not just giving the bare minimum. We talk about the preferential option for the poor and the vulnerable, which means if you're more vulnerable because of your illness, you are given you're given the second mile. We're going to go the distance with you. And that's one of the concepts that drives the decisions that we make, particularly around the allocation of scarce resources in mental health care if we're part of a Catholic healthcare organization. So when we think about the health and well-being of our patients, it's not just about their mental illness. We're going to look at the entire person, all of it. And if we're being just, we're paying attention to all of it. And there are part of families that are struggling, so we're paying attention to that as well, as best that we can. Finally, there's the call to compassion and ethical reflection. We recognize that by serving the well-being of each person, we have to seek the good of all as well. And so in our tradition, this is called the call to foster the common good. This is really elevated right now during the pandemic because under normal circumstances, what the individual wants, it takes highest priority in the way that we try to make our decisions. We're in a position now where what the individual wants or what the individual needs is being stressed by the fact that there are multiple needs coming at organizations, and they have to start making decisions based on what is best for all, what's going to do the most good, and not necessarily all what is best for the individual. So uh, that's part of how ethics switches its focus during times like this. But anyway, what I wanted to, excuse me, what I wanted to say about ethics here is that we have a very robust ethics process. Anyone can ask for ethics consultation. We do upwards to 100 ethics consultations a year that are formal. We have lots of informal consults, but anybody who's looking for assistance in working through an ethical issue is encouraged to seek ethics consultation. We say ethics isn't something that we engage because someone's done something wrong. Ethics is something that we engage because we recognize we work in a highly complex treatment environment and confusion comes with the territory. And so sometimes we need to talk. So don't hesitate to call me or to engage a member of the ethics committee if you have a question. We are certainly agreeable to um, arranging ethics consultations with individuals and teams as necessary. We also have a research ethics board here, which means that every single study that is planned at Waypoint goes through ethics review, independent of the organization. There are members that are external to Waypoint. We have external ethicists, we have scientists and legal experts, and so at Waypoint, what we call the Waypoint research application process. That, if you want to do research, that goes to the senior team who decides what kind of research Waypoint wants to do. But once that decision is made, it goes to the RAB to decide whether or not that research is ethical and scientifically sound. So what are Christian moral values that are informing Catholic healthcare? Well, basically they're human values. They're not substantially different than what you would see in any other religion. If you want to boil it down to one thing, it's basically this idea of doing unto others as you would have them do unto you. That's what recognizes that we're all looking at this from a human perspective, bringing our heart, not just our hands. But really, even better than the golden rule, or the idea of doing unto others as you would have them do unto you, is the platinum rule, which suggests do unto others as they would have you do unto them, which means that we're going to go a little further in our exploration of what a person would find to be good, and we're going to seek to do unto others as they would have us do unto them in the work that we provide. So what Bernardin says about what makes a Catholic hospital difference is this idea of bringing comfort and strengthening their confidence in life and giving them a reason to hope. Because, in mental health care in particular, when a person is diagnosed with a mental illness, hope is one of the first things that generally walks out the door, and one of the first things that we as staff need to help restore. And to be honest, there are some times when people develop a mental illness where their life pretty much has changed forever. and it's going to experience many deficits that are going to uh, make it feel and appear less meaningful to them than it would have been prior to. But some people go back to a pretty normal and meaningful life. They get jobs, they get married, uh, they do things that they dream they would be doing in their lives. So it's our role to come alongside people and help to restore their confidence in that process. And that's what recovery is all about. So finally, and in summary, I just want to say that while rooted in the Christian tradition, the ethical framework that is built on the examples and teachings of Jesus are not just Christian. In fact, if you looked at them more closely, it's all about common sense. You know, if you thought about anything long enough and you did what made sense from a common sense perspective, you probably arrive right at the same place that we would in in terms of Catholic healthcare, recognizing that what we're trying to do is bring empathy in our service to our patients and ultimately then to treat others in the way that we would want to be treated ourselves, and even better, to understand what they would want us to do and treat them that way. So thank you. Again, here's my information. If you have any questions or comments, you need any further information at all, please don't hesitate to get in touch with me. Thank you very much.